day, everyone. Now, I quickly want to talk about a particular question I received a few days ago. The person was actually asking about a test that can actually be done to know if a woman who has had a cesarean section in the past to know if she can actually have a vaginal delivery in this present pregnancy. Now, the truth of the matter is trial of labor, which is an attempt at looking at the possibility of if a woman can actually have a vaginal delivery following a previous cesarean section, is something that is well recognized and is something that should be looked into very well in order to let the woman have another chance of having a vaginal delivery following a single cesarean section, and of course that would optimize her better in the other subsequent pregnancy for the fact that she can still have a vaginal delivery. But if at this particular pregnancy in a woman that has had cesarean section before, she's having CS again, meaning that she's now having like 2 cesarean delivery. Like it's more or less like she cannot have vaginal delivery again. So it is very important to be very sure that the very first CS is justified. If that has been done already, if you are meeting a patient again with one previous CS, it is also very important to justify this second repeat CS to be very sure that you are not going to confine such woman to a lifetime of cesarean section. So that means the second cesarean section that is not yet done, you have to be very sure, so that after this, everybody knows that most likely she's not going to have a vaginal delivery again. So now my answer to our question was that there's actually no particular test that you do to know if a woman that's had CS in the past can now have a vaginal delivery now. It all depends on putting everything together, like the CS, the past CS that we are talking about. Why was the CS? Why did she do the CS then? What was the outcome of the surgery? Was there any complication? Even the birth weight of the baby at that point, even to the place or the hospital where the CS was done, it's also very important to know. All these things are going to be put together, add 1 or 2 other things to it to determine if you can actually let her try labor. So we call it trying. And if at the end of the trial of labor, it is successful, then we will say that a woman has had a vaginal birth after cesarean section, which is more like a successful VBAC. It's something that a lot of people know. VBAC, vaginal birth after cesarean section. It's actually like a trial of labor. You are going to try. If it is possible, she's going to have vaginal delivery. If not, then you go ahead to have another form of delivery. Now, apart from this, the present pregnancy, which is the index pregnancy, is also very important to know 1 or 2 things from this index pregnancy that will help the woman or the doctor to say that you want to schedule or you want to assign a woman to a trial of delivery. For example, like this index pregnancy, it must be free of any complication. You cannot be saying that you are like hypertensive patient in pregnancy, diabetic patient in pregnancy, or you have been having lots of morbidity in this pregnancy, and you feel that with the previous car, you still want to try vaginal delivery. Even these singular complications that are there now, sometimes they may be enough reason to go for CS. So what I'm saying in essence is, if you are going to still try vaginal delivery after you have had 1 single CS in the past, it is very important that this present pregnancy that you are considering, looking at the mode of delivery, you have to be very sure that there is no comorbidities. So that is one. Another important thing is that the final conclusion would actually be made at about that 36 weeks of gestation, when the weight of the baby you have the idea. A baby that is beyond average, take for example, a weight of the baby that is already beyond 3.5, you don't want to let that woman like try labor with a previous car. The risk is becoming more. So in such case, weight of this present baby, the fetus, is still something that you still have to consider before you say let the woman go for trial of labor, or better still go for elective CS. Another important thing is I mentioned that the previous CS that she has had, now what was the outcome? Take for example, someone has had cesarean delivery in the past and there was a lot of morbidity following that. The possibility is there that those morbidities, or like especially infection that affected the woman at that time, might have reduced the integrity of the scar, meaning that if there's reduction in the integrity of the previous scar, you want her to try labor now, the possibility is there that there may be rupture, which is the tearing of the uterus in this present labor. So it's something that we also consider. Another thing that we consider is we talk about the place where he has had the CS. Now, why we talk about this is that there are a lot of places where people do cesarean section. Now, you have done CS, everything to you looks fine, but a classical incision on the uterus. And if a woman has had, or she has been told that the CS that she has had is actually a classical one, there's no trial of labor in such kind of woman. So that is why looking at the place where the CS has been done is something to really consider also. I also talked about the reason that the CS was done. Now, why you need to know the reason is that there are some reasons that they can't even change. Be it 10 pregnancies, 9 pregnancies, these conditions would always be present. These are called recurrent indications. When you say a woman is having a recurrent indication, there's no point in saying that woman should come and try labor. For example, a woman that has tiny waist, or because of infections like polio or childhood rickets, there is pelvic contraction, whereby we say there is pelvic contraction. So such kind of woman is not likely to have a successful trial of labor. So this recurrent indication is something that when you have it, when it is the reason for the previous CS, you can't try labor again. So now the other things that may be like a positive for the woman, like beneficial for a woman that is going to try labor, is the fact that if she has had a vaginal birth after the last CS, maybe before or even after it means that the pathway has actually tried delivering baby before. So that means baby has passed through before, maybe before the CS or even after the CS. So it is like a plus for her. So that means these are things that you put together among other things to decide if a woman can still undergo a trial of labor. If not, she would rather go for elective cesarean section. And by this, when you have been counseled to go for elective cesarean section, you should take this and understand very well the reasons why they have scheduled you for elective repeat cesarean section. Now, the truth of the matter is, if you are going to be worried, about the option of your doctor with you, I think the best bet is that from the beginning, if you are going to register that pregnancy, register in minimum in a secondary health facility, in a center whereby they can do emergency cesarean section, there is blood transfusion services available, there is like obstetrician is always available. Now, if all these things, neonatal care is not available, if any of this or all of these things are not available, you have no point in registering or taking care of your pregnancy in that center. Go to a center so that even when you feel you want to do a trial of labor, obstetrician and the co-workers that are proficient enough to monitor such kind of labor, which is high-risk pregnancy. Go on high-risk pregnancy. It's going to tell you more. I want you to like you to watch that video. Now is high-risk pregnancy. So by that, you don't want to toy with the outcome of such, because of the fact that you really want to do CS again. So from the beginning, find a better center where all these things that I've mentioned are available, so that optimal care will be guaranteed for you. And another important thing to know also is that if you are willing, or you feel that you may want to try vaginal birth again after you have had a CS, I want to employ you that in between the two pregnancies, you should have at least nothing less than like a year before you get pregnant in between. Now, you can't come to the hospital, you have had cesarean section in January, and before you say Jack Robinson, say like May, you're already pregnant with another baby, and before mid the second year, you want to have another baby, and you feel in you that you want to have a trial of labor. No, you cannot do that now. You don't want to do that. So that's why we are saying that if you feel that you may want to try labor later, and you have had a cesarean section in the past, so the best bet is that let's say space, give like months, nothing less than like 12 months between pregnancies. And of course, we are talking about minimum of 18 months between the two deliveries. If this is not met, and we know that for this singular reason, a lot of obstetricians want to schedule you for elective CS. So by and large, I've been talking about the things that you consider before you schedule a woman for trial of labor after she has had a previous cesarean section. The summary is that if you have had 2 CS in the past, most likely you are going to have a repeat cesarean section. But if you have had 1 cesarean section in the past, you really want to optimize the option in the next pregnancy or in the next delivery, because in order to reduce, like, give yourself the chance of having a successful vaginal birth after CS, you register in a better center that can guarantee blood transfusion, neonatal care, emergency cesarean section, and good anesthetic management. So all this, they have to be there. And getting pregnant should not be that soon. And also, be sure that where you are, you have obstetrician-led team that can actually be present during this trial of labor, as we have known that is high-risk pregnancy. Now, if you are yet to subscribe to my channel, I want you to like, you share, and subscribe to my channel. It will give me better idea of what we really want when you comment on my videos. And I also want you to share, then subscribe to my channel. Thank you for staying tuned. I'm Dr. Antenatal. I'm a consultant obstetrician and gynecologist. Thank you for joining my video.